All right. Welcome, everyone. It's Children's Environmental Health Day. We're super excited to have you guys with us. My name is Hester Paul. I'm the National Director of Children's Environmental Health Network's Eco-Healthy Childcare Program, and we're just going to go around and quickly introduce ourselves.
Hello, I'm Nikki Garo. I am Director of Early Childhood Health Programs for Child Care Aware of America. Our organization is a membership organization mainly comprised of child care resource and referral agencies, but we also have child care providers as members as well as other interested stakeholders, and we support these agencies in their work.
Good afternoon. My name is Michelle Barnes. I'm the Executive Director at the Helen Walton Children's Enrichment Center. We are a program that serves about 250 students across the Northwest Arkansas region. Everyone from those that may be homeless to those working at the corporate office of Walmart.
And I'm Sue Kovaleski. I work in a child care resource and referral organization in upstate New York, which means I'm closer to Canada than New York City. So we're very rural where I live. And CCR&R, Child Care Resource and Referral Organization, is sort of the support organization for child care programs, whether it's family child care in someone's home, daycare centers, parents, anybody with any questions or in need of assistance in anything early childhood child care.
Great. So today we're hoping just to have a live discussion with all of you guys about why children's environmental health is particularly important to yourselves or to your organization. And to get us started off, I'll say for us, we have been running the Eco-Healthy Childcare Program, which is a national program that works to reduce potential exposures to toxic chemicals within all types of childcare facilities across the nation. And so we want to distill best practice research and turn it around and make it appropriate, accessible, and also offer cost-effective strategies. We know not everybody can replace all the flooring in their facilities, for instance, but we might be able to talk to them about how to regularly change out filters within their HVAC system, or maybe what baby bottles to choose so that you can know that you are avoiding unnecessary exposures to toxic chemicals. And so we work with you guys and other partners across the nation to uplift children's environmental health so that people are thinking about environmental health as a key component to children's health in general. So not just getting kids outside to play or making sure that they're vaccinated, for instance, but also just thinking about what slight changes can we make within facilities to protect children's overall health and wellness. And we also want to be supporting all types of communities. So regardless of their geographic region or of their maybe socioeconomic status, we want to be supporting all little kids so that they have equal opportunities to health and wellness within early care and education.
Well, I'm happy to start off. At the Helen Walton Children's Enrichment Center, a few years ago, we were in the design phase of our new campus. And during that time, 2 of our children were diagnosed with forms of cancer. And it was determined that it was driven by environmental causes. With that, that caused our organization to pause and think about what did that really mean? And what could we do differently during the design phase to positively impact the health of young children? And we were very lucky to partner up with LTL Architects out of New York to help us design a healthy campus. With that, we were able to eliminate 6 major classes of chemicals from the ground up. And once we were done with the facility itself, we went through our due diligence to make sure that the furniture, toys, equipment, educational products were at least reduce the possible exposure to chemicals through those items. And so we were really excited to be on the forefront of this. We hope to act as a model. Again, as Hester indicated, not everybody has the opportunity to build a new campus or to replace all their flooring. But when you do hit those milestones and are thinking about new paint or new toys, we want to be a resource for those programs to show them it can be affordable and doable in early education.
Well, thank you.
So I'm a member of Earth Day #1 in the United States when I was in college. And I thought I would be saving the earth one paper towel at a time. And then as I got a little bit older and wiser, I realized we had to save children at least as much as we had to save the earth. So I started learning more and more about things that we could do to keep children safe from some of the toxins that are poisoning the earth as well as our people. And then when I was pregnant with my first child, we live in a farmhouse, and we decided to strip some of the paint in there, and I knew nothing about lead paint, and realized when my child was born with kidney issues, I will forever wonder, what did I do that had an effect on his health? And he's fine now, but that's something that you don't know stuff until somebody tells you. And we need to spread the word about how there are things that we can do. Like Michelle says, there are things that we can do that are safer for children, and being inspired by children with cancer to reduce their risks as well as everyone's risks is what's important. And we need somebody to tell us what we need to know, because it's not information that's always right out there in front in the news. So that's why it's important. We don't want sick kids that don't need to be sick.
Mm-hmm.
And just piggybacking on what Sue said, so at Child Care Aware, our kind of job is to support the childcare system to make it safe and healthy for kids. And that includes environmental health. And also I would add, make it safe for the people working with the kids, because they are also being exposed to the same environments. And we really consider it an equity issue. Like you said, you know, if people don't have the information they need, or especially it can become overwhelming. Like Hester's program is great because it gives you tips along the continuum of ways you can make a safer environment. So at Child Care Aware, we've focused on kind of helping child care programs to minimize exposure to lead, making sure the site is as safe as possible, minimizing exposure to like car exhaust, like making sure pickup and drop off is not exposing children to, or minimizing how much exhaust they're being exposed to. And then reducing toxic chemicals, and especially now with new enhanced cleaning protocols due to the pandemic we're in the midst of, really focusing on safer cleaning techniques, as well as ventilation systems to the extent they can be addressed in providers' sites as well.
Yeah, well, that's interesting you say that, because that's the next kind of topic for all of us to think about, is how has COVID or coronavirus changed our respective work? And like Nikki said, I think a lot of it is in a very perverse way, the coronavirus has highlighted the importance of children's environmental health and made people more aware that we should be thinking about what chemicals might children be exposed to. And the most common chemicals, I mean, the chemical components that we'd be thinking about in the context of coronavirus, what are they cleaning with? What are they disinfecting with? Are we making sure that children are not touching these chemicals or using them themselves? What is the indoor air quality looking like? Are people properly ventilating? And so if there is a silver lining, I think, to coronavirus, it's that people are more aware of children's environmental health. And I think that we've also seen that there's been a big shift in childcare, right? Because many people were not able to stay open, their childcare facilities. So there are less childcare facilities that are currently opening. And if they are open, then they have a lot more to contend with. And I know, Michelle, you might be speaking about adjustments that you've made within your facility, but it's become more difficult, I think, right now for providers to pay attention to all of the requirements or best practice suggestions that are being put out by the Center of Disease Control and Prevention, for example. But in a way, these requirements, I think, are beneficial because they're having us pay greater attention to chemical exposures and maybe what we can control to reduce possible exposures. But I'll pass it off to see what you guys are thinking about that.
Well, I'll just, in how things have changed for us with COVID is we, heard from our constituents, all the different concerns you would have with closing your center and then reopening it, and as well as the CCR&Rs on how to support their childcare systems. So we actually set up a center pretty quickly to help states and providers really respond to COVID the best way possible, recognizing that it changes daily. So we have an emergency childcare and technical assistance center to provide resources from business continuation, sanitation and disinfection protocols, and also tips on both accessing safer chemicals, and acknowledging that we're introducing potentially new risks as that gets enhanced. So how to minimize exposure for, like I said, the children as well as the providers themselves. And so we're just continuing to work with our partners to try to ensure the safest space possible. I think that also along with that comes a lot of challenges, but I think we can talk about those later in the discussion, but I'll pass it on to whoever else wants to dive in.
So for me, I do a lot of workshops for people who do childcare. And if I share some of the information that I've learned from eco-healthy childcare and plan a workshop around that so that people have a checklist of 30 items that they can see, maybe I can tweak this a little bit and make it safer for children and healthier for our staff, I can do that. So I used to do workshops locally, go into programs and help them carry out some of the plans that they had in a safer and healthier manner. And I would do programs locally as well as statewide conferences and try and spread the word to people who do childcare in hopes that they would share that with the families that they work with. So that was what I used to do. And then COVID-19 came along and federal money came for CARES grants for different childcare programs. And the part of our work in my childcare resource and referral organization was to help childcare providers get the things they needed that would clean and sanitize and disinfect their programs and personal protective equipment. So we tried to buy stuff for people in bulk, and it was very hard to find some of the safer products, let alone any products that did what recommendations suggested they do to keep the spread of COVID-19 down to a minimum. So that was one thing, trying to find those products at all, but going by lists of safer products that would be less harmful to children was a real trick. And so that was part of what we did. And then knowing that people are having trouble, how do I disinfect this? What do I need to do? How often? And all those things. So I was literally planning a workshop on sharing this information, which I'm going to do in a couple of days, but preparing that information. And then I got an email from Eco-Healthy Childcare that asked if I would be on this panel. And I thought, oh, this is just so coincidental. And so having to do this workshop virtually instead of in person has been a real trick to try and make it interesting and tangible, and how can people be active while sitting in front of their computer and engaged. So trying to help people get the safer products for what they need and understand what's too much, what's not enough, what's just the right balance of what you can use to follow your state's recommendations for slowing the spread. So those are a couple of examples of things that have changed the way that we do things, is trying to develop policies and procedures that can be safer for children and staff in their child care programs, be they center-based or home-based.
So kind of going off of what you were sharing, as a provider, needless to say, COVID-19 shook things up. About half of our parents began working from home, and many opted to go ahead and keep their children with them due to the fact that this is something unknown to all of us. We're learning on the go. With that, we had many centers across our region that weren't open, and there wound up being a crisis for essential workers. So we had to think about health and safety and moving our current children into specific wings of our school and opening a wing for essential workers. And it didn't dawn on me at the time. Our families were very well versed with our cleaning protocols and the type of products that we select for the health and well-being of the young child, and of course the teachers. Oftentimes we were asked why we weren't using harsh bleaches within our program. And we realized we had to take a step back and educate this new population of families coming into our program. And so that wound up being a little bit of a hurdle, but I think it was also a blessing in the respect that we were getting the word out about aerosols, about certain types of chemicals, and what that could do for a child's health. And why we selected the products that we did, and that they're just as effective in disinfecting, especially during this time. Mm-hmm. For us, we, while disinfecting and sanitizing is part of our normal routine, cleaning all of the toys and all of the surfaces on a daily basis was a bit of a challenge for us. But we've gotten into a new norm, and now it's just a part of our daily practice. But again, it's just getting that message point out that there are healthier alternatives to cleaning during this crisis.
Mm-hmm. Thank you, guys. So now I want us to pivot a little bit with all that we've just shared and think about what are challenges, which we've kind of just gone over, but also what are opportunities in light of the coronavirus, given that I think we'll all be adjusting for quite a while here. I think for us at the Children's Environmental Health Network, it not only has brought new partnerships through, for example, this funding that we've received from the CDC. The Center of Disease Control and Prevention funded many different national entities focusing on how to support early care and education professionals. So for example, the National Center for Healthy Housing, the National Association for City and County Health Officials, there are these different national organizations that all play a role in either going through the city and local health departments, or maybe working with different contractors to think about the health and wellness of where children are spending young time. So part of it has brought new opportunities for how can we all collaborate and work collectively to bring safe messages to people. But I think also it is the opportunity to increase the importance of childcare in general. It's very important to think about where are children spending up to 40 hours or more per week. Are these environments safe? So not only are the caretakers equipped with being emotionally ready, and cognitively ready to support these children, but are they also receiving the supports that they deserve to think about potential chemical exposures? And though we all collectively have been doing this work for many years now, I think that there's a new avenue or inroad for people to be receptive to these messages. So I guess I would say that if we need to see this in a positive way, it would be that I think people are more open to hearing messages about how can we protect our little ones, and maybe they're thinking about how to protect the little ones from coronavirus, but we are also thinking about how do you protect a child from coronavirus, and how do you also think about protecting them from chemicals that are being used to reduce those exposures. So I guess just bringing to light different things that we can do. And sometimes it's what you're purchasing, and sometimes it's really where you're spending time, how you're opening windows, making sure that they're screened, of course. But I guess my point is, it's not just what you're purchasing. It's also a lot of practices of looking at your indoor air quality, your air quality index, things like that, to know whether or not it's safe to take children outside. But I'll pass it on to you guys to see what maybe opportunities you all see in light of coronavirus, given that we're in for the long haul, I think.
Well, I'm happy to share a few positives that have come about. Obviously, I shared that we had the opportunity to educate a completely different population of children and their families. But going back to what Sue indicated on the front end was accessibility of healthier cleaning products, especially on the front end where stores were completely sold out of cleaning products altogether. And I wanted to also think about the fact that healthy eating and how some chemicals are also in our food sources. So we had an incredible opportunity to partner with several community organizations, the city, and even Girl Scouts of America and several other organizations and foundations to do a few things. One, 45% of our population are on the lower socioeconomic spectrum, yet their health matters just as much. And so it was very important that PPE equipment was available to such families, not just to the children, but their families at home. A lot of our families were furloughed or laid off during this time frame. We made sure that healthy laundry soap was available at our organization to take home, that they had food vouchers to shop and not just purchase processed foods, but fresh fruits and vegetables. We sent home cleaning packets and hand sanitizer that were healthier options so that they could continue healthy practice in their home environments, which was very important to us. It's not just about the 40 or 50 hours that they spend with us, but this is very inclusive. And it really needs to include the families and their home environment as well. So it really got our community to start thinking differently. And we're hoping to see that the healthy products span into other early ed programs, into parent resource blogs throughout our community, and realize that there are other avenues to explore.
Well, I think that your program seems like a shining light in the midst of all of this. As Hester mentioned, this pandemic has really highlighted the need for increased investment in childcare kind of across the board, and several other aspects of our social services. But we are still trying. We want to support the childcare community as much as possible, but we know there's challenges such as there's still some access issues or accessing safe products, especially, you know, as an example that we all know is the hand sanitizer issue. I mean, even in my own house, we bought a giant thing of it, and then, you know, 2 weeks later realized it was not recommend. It was on the FDA list of hand sanitizer not to use. I have a son that's 4, so now I'm like, I can't walk in the building because they're following protocols to reduce risk of COVID spread, but like peering to see what their hand sanitizer bottles look like to make sure that it's not on the list as well. So I just think there's just a lot of challenges, and to Sue's point of getting the information out to everyone, I worry about those who aren't connected to their CCR&R or to a network of other child care providers or the public health department to be able to get the information they need. Those populations are probably the ones that are serving the most vulnerable children and have the most vulnerable workers as well. So I know personally that's who I'm most worried about, and we're going to continue to work to, you know, reach out to especially home-based providers who might not be as connected into the information highway that, you know, changes by the hour. If you're at the CDC or, you know, other places. So it's just going to continue to be a challenge in the midst of this pandemic and then going forward afterwards.
Nikki, I'm going to bounce off of that. You brought up a really good point. Something I guess because it's become such a routine nature in our organization now, at the beginning, when families were still allowed into the physical campus, we had multiple hand washing stations, and we required not only the children but the parents to wash their hands thoroughly, as we know that that's one of the biggest defenses against COVID. And to this day, we have some outside hand washing stations, and you hear parents singing the ABC song as they're washing their hands. And so I think through COVID, we've gained some better practices on just better hygiene and safety of hand washing, just something as basic as that. Often we stuck our fingers under the faucet with some soap really quick, and 2 seconds later we're drying our hands. Now we have families, you know, singing songs and realizing that 20 seconds is incredibly important. So again, something that doesn't cost, but just changing habits that I've seen occur during COVID.
And my piggyback on both of those things also, the challenge of the guidance documents that are available. You know, CDC sent out guidance and then it changed a little, and then it was about summer camps and schools and childcare. Didn't know if that was for them or for somebody else. And then New York State had guidance and that would change. And so people would call our office saying, you know, what the heck are we supposed to do now? So it was our job to help them sort out those challenges. And it was also an opportunity that child care providers were really calling our office in desperate need of some answers because they did want to do what's best for children and families and staff. So some of the opportunities were the unintended or unanticipated things that would happen. I was on a Zoom meeting with child care center directors this afternoon who were saying, you know, kids are healthier now, not just from COVID, but from everything. And if a child is a little bit sick, in the old days, parents would send the kids anyway, and now they're keeping kids home more often. So just if it's a cold, less kids are getting colds because they're not there, spreading their germs. I know some programs who are changing from indoor programs, and this is even up here where there's snow in the winter. They're opening up totally outdoor classrooms year round and figuring out how to do that. And in the summer, it was a lot easier than it will become winter time, but they're planning to change so that children are going to be exposed much less to some of those chemicals that have to clean indoor spaces differently than we would take care of our outdoor spaces. And the fresh air is going to do a lot of good for a lot of children and staff members. So those are a couple of the unintended results of COVID-19 new strategies and new guidance documents. And just in general, people, as you said earlier, are more aware of things that they should do right. As you talk about hand washing, it becomes more important to do it properly. And all those kinds of things that relate to everybody's health, not just children's health. And the guidance documents that are coming out of Eco-Healthy Childcare are just beautifully simple, refer to guidelines but from states as well as the CDC, but are easy to follow and offer people who use those documents opportunities to make their own choices based on sound information that can help them meet those criteria in the guidance documents and do it more safely for their children. And I just think it's wonderful that as a result of all that's going on, we've done business differently for the past several months. And I hope we take the good parts and continue, and the challenges we hope will diminish as time goes on.
Yeah, so true. I think I would say to jump on that is that childcare professionals have so much that they're dealing with on a regular day, right? All the families they're supporting, all the children that they're supporting. And in times like this, where there is new guidance being released and being altered pretty regularly, and that is what we're seeing, it's an additional task, and sometimes they don't have the time or capacity to be following it. So I think if we being leaders within the early care and education field, can simplify what the messages are and make it less intimidating and do a little bit more hand-holding, then I think it all becomes more realistic and doable. But I know that we've been trying to put ourselves just kind of in the vantage point of a very busy family child care provider. If we can simplify the message for them and send them to the best resource that we know to be available, then that's hopefully helpful. I think the other thing to remember with that, though, is we don't have national guidance that's applicable to everyone at every time. And so we're often saying, you know, listen to what the CDC is saying, listen to what we know and we're reading to be the best practice guidance, but it's also very important that you're checking in with kind of your local standards and mandates, right? Because they are different. And for those of you listening who aren't part of kind of early childcare in your regular profession, every state has different childcare licensing regulations. So that just right there tells you how nebulous it can be at times to try to figure out what's what for different programs around the country. But with that, we'll close up. So thank you guys all for joining us. And we really appreciate all the work that you're doing. And for those listeners, we really appreciate you guys taking the time to learn a little bit more about how coronavirus is affecting our daily work and what we're doing collaboratively to try to reduce toxic exposures within early care and learning facilities. So thanks, guys.
Thank you.
Thank you for inviting us.